Imagine a time when a mysterious illness emerged, baffling doctors and striking fear into communities. That's exactly what happened in the early 1980s with the emergence of AIDS.
Hmm.
Today, we're diving into the very beginning of the AIDS epidemic using a first-hand account from a history podcast.
Oh, wow.
We'll hear about the initial confusion, the struggles of early patients and doctors, and the groundbreaking discoveries that paved the way for our understanding of this complex disease.
What's fascinating about this source material is how it transports us back to December 1980 in San Francisco.
Okay.
We meet Dr. Jim Groundwater, who's facing a medical enigma.
Oh.
His patient, Ken Horn, is experiencing alarming symptoms. Drastic weight loss, persistent fatigue, unusual lesions.
It's like trying to solve a puzzle with missing pieces.
Exactly. It's a medical mystery. And the tests,
What do they show?
they offer no answers.
So Dr. Groundwater is desperate to help his patient, but he's working in the dark.
And for Ken Horn, it must have been terrifying. Imagine your body betraying you and no one knows why. This sense of urgency underscores the initial bewilderment surrounding this new disease.
Then on June 5th, 1981, the CDC publishes a report on a rare form of pneumonia affecting gay men in Los Angeles.
Okay.
It's a small blip on the radar, but for Dr. David Ostro, a medical researcher and a gay man himself, this report hits close to home.
He's not alone. Many in the gay community are starting to notice a pattern, a disturbing trend of young, healthy men falling ill with unusual infections.
But the initial response is somewhat muted. Some gay newspapers even downplayed the report.
Really?
And major media outlets like the New York Times barely covered it. Can you imagine the frustration? This new disease is emerging, but it's barely making headlines.
It highlights how marginalized communities often face an uphill battle in getting their concerns heard and addressed.
But soon the situation becomes impossible to ignore. Doctors across the country are reporting similar cases, overwhelming the CDC.
Wow.
Dr. Jim Kern steps in to lead a task force to investigate this mysterious illness. They're racing against time, trying to understand a disease they can't even name.
What strikes me here is Dr. Curran's approach. He recognized the importance of engaging with the gay community.
Yeah.
Building trust and encouraging people to come forward despite the fear and stigma.
I see.
It was a crucial step in gathering the information needed to understand this new threat.
It was during this time that the name GRAY-RD was coined Gay-Related Immune Deficiency.
Oh, wow.
It's a label that immediately creates a sense of fear and otherness.
The name itself fueled existing prejudices and sadly further marginalized a community already facing immense challenges.
So how did researchers start to unravel the mystery of transmission? Dr. Curran, through meticulous investigation, begins to see a pattern. He theorizes that sexual contact is the primary mode of transmission.
Okay.
However, his hypothesis is met with other theories, some of which, like Dr. Joe Sonnabend's immune overload theory, unfortunately added to the stigma.
The immune overload theory suggested that the frequent exposure to multiple pathogens due to a certain lifestyle weakened the immune system, making individuals more susceptible to illness. This, of course, further fueled the flames of prejudice and discrimination.
But then comes a turning point. Dr. Curran identifies cases outside the gay community. Intravenous drug users, individuals of Haitian origin, and even a hemophiliac patient who received a blood transfusion. This discovery is crucial. It shatters the misconception that this disease is confined to one community. The realization dawns that the disease is bloodborne. It's a game changer, forcing a reassessment of everything they thought they knew.
Yeah.
And that's how GRID becomes AIDS, Acquired Immune Deficiency Syndrome, a name that reflects the broader understanding of the disease. It prompts restrictions on blood donations from certain groups, a necessary step to prevent further transmission, but also one that further marginalizes those already facing discrimination. It's a complex and heartbreaking situation.
Yeah, it really is. This shift in understanding is crucial. It really throws light on the disease's true nature. But it also intensifies the fear surrounding it.
Absolutely. The stigma surrounding AIDS was already incredibly damaging.
Right.
But as the understanding of its transmission grew, so did the fear.
It was a time of intense anxiety and uncertainty. People were afraid to touch, afraid to be near those diagnosed with AIDS.
Right.
It's tragic how misinformation and fear can amplify suffering.
But amidst this darkness, a beacon of hope emerged from a perhaps unexpected source: the world of music. The 1992 Freddie Mercury tribute concert at Wembley Stadium wasn't just a musical event. It was a global declaration of compassion and a catalyst for change.
This concert was a turning point. Seeing so many iconic artists come together to honor Freddie Mercury, who had bravely announced his AIDS diagnosis,
Yeah.
it helped humanize the disease. It challenged the prevailing stigma and showed the world that people with AIDS deserved love and support, not fear and isolation.
And the concert brought together millions through music, but it also raised crucial funds for AIDS research. It was a powerful reminder that we're not alone in this fight.
And speaking of fighting, we can't forget the activists who tirelessly advocated for research, treatment, and recognition of the epidemic.
Right.
People like Larry Kramer, a playwright and author whose powerful voice and actions helped establish the Gay Men's Health Crisis.
Okay.
This organization provided vital support and services to those affected by AIDS.
These activists challenged the government, medical institutions, and even their own community to take action. They demanded better research, affordable treatment, and humane policies.
Their courage and persistence played a crucial role in shaping the response to the epidemic.
Yeah.
They put a human face on the crisis and helped shift public perception, moving from fear and judgment towards empathy and action.
They truly were a voice for the voiceless.
Absolutely.
Their fight wasn't just about medicine, it was about human rights,
Yes.
about dignity and respect.
Oh.
Their efforts undeniably saved countless lives.
Their tireless efforts eventually led to a major breakthrough in the early 1990s.
Oh, really? What was that?
The development of antiretroviral drugs. This was revolutionary. These drugs work by targeting HIV itself, inhibiting its ability to replicate and spread within the body.
These medications transformed AIDS from a death sentence into a manageable chronic condition.
Right.
Suddenly there was a glimmer of hope, a chance to live longer, healthier lives.
It's remarkable how these advancements gave not just extended life, but also quality of life to those who had been resigned to their fate.
But medication alone wasn't enough. Access to care support systems and education played an equally vital role in this new chapter of the AIDS story.
You're absolutely right. For these treatments to be effective, people needed access to health care.
Right.
And this access was often hindered by stigma, discrimination, and poverty. It was a fight on multiple fronts.
Education also became a crucial weapon in the fight against AIDS. It wasn't just about promoting safe sex practices.
Right.
It was about dispelling myths and tackling the fear that surrounded the disease.
Information became a powerful tool. Understanding how HIV is transmitted, how it can be prevented, and how to live a healthy life with the virus became essential in changing behaviors and saving lives.
And those educational efforts continue to this day. Today, we have pre-exposure prophylaxis, or PrEP, a medication that can significantly reduce the risk of HIV infection. HIV testing is more accessible than ever. And importantly, the stigma surrounding HIV, though still present, has lessened significantly thanks to decades of education and advocacy.
It's incredible to see how far we've come in terms of awareness, prevention, and treatment. It's a testament to the collective efforts of researchers, healthcare workers, activists, and most importantly, those living with HIV who bravely shared their stories and fought for a better future.
We've covered a lot of ground, from the initial fear and confusion to the emergence of groundbreaking treatments and the tireless work of activists. But it's important to remember that the fight against AIDS is far from over. You know, it's easy to get caught up in all these advancements we've been talking about.
Yeah.
And forget that millions of people around the world are still living with HIV. Many face immense challenges in accessing the treatment and care they need.
That's right. While we celebrate all this progress,
Yeah.
it's crucial to acknowledge the stark realities in other parts of the world. Access to healthcare remains a significant barrier for many.
And, you know, this epidemic has reshaped our understanding of public health. How so? Well, it's no longer just about treating a disease. It's about addressing social inequalities, promoting education, empowering individuals to take control of their health.
Absolutely. The AIDS epidemic forced us to confront difficult conversations
Right.
about sexuality, drug use, and marginalized communities.
They see.
It challenged our preconceived notions and pushed us to develop more inclusive and holistic approaches to healthcare.
And we can't forget the role of art and music in this fight. Think of the iconic red ribbon,
Oh, yeah.
a global symbol of AIDS awareness and support.
Art has this incredible power to connect with people on an emotional level, to break down barriers and foster empathy and understanding. It can spark conversations and inspire action in a way that scientific data alone often can't.
It's about making the science personal and relatable, seeing the human faces behind the statistics, and understanding the real-world consequences of this disease.
Those firsthand accounts from the early days of the epidemic are so powerful.
Absolutely.
They remind us that this isn't just a historical event. It's a lived experience, a tapestry of individual stories
Yeah.
woven together by resilience, loss, and hope.
From those dark early days marked by fear and prejudice, a spirit of activism and scientific inquiry ignited.
Right.
We've come a long way from a time when an AIDS diagnosis was essentially a death sentence.
It's remarkable, isn't it? Today, people with HIV can live long and healthy lives,
Right.
thanks to effective treatments and prevention strategies. It truly showcases the power of human ingenuity and unwavering commitment to finding solutions.
But as we said earlier, the fight isn't over. Challenges remain, especially in ensuring equitable access to treatment and care globally. And the stigma surrounding HIV, though reduced, still persists in many parts of the world.
It's a reminder that progress isn't always linear. There will be setbacks. But we can't afford to become complacent.
No.
We need to continue pushing for research, advocating for equitable access to healthcare,
Right.
and challenging stigma and discrimination wherever it exists.
So as we conclude our deep dive into the history of AIDS,
Okay.
what's the one thing you want our listeners to take away from this conversation?
I think it's the understanding that the fight against AIDS is a shared responsibility. It requires a global effort, a commitment to collaboration, compassion, and unwavering hope. It's about recognizing our interconnectedness
I see.
and understanding that the health and well-being of each individual are inextricably linked to the health and well-being of us all.
That's a powerful message. And remember, this is just a starting point. If this deep dive sparked your interest, there are countless resources available to learn more.
Absolutely.
So keep exploring, keep learning, and keep the conversation going. Because knowledge is power. And in the fight against AIDS, we need all the power we can get. Thanks for joining us on this deep dive. Until next time, stay curious.